We are going to begin the webinar here in one moment. Okay. So go ahead and get started. I just want to thank you all for joining us this evening. My name is Melissa McLean, and I am the marketing specialist for Phoenix Physical Therapy. Today, our team of physical therapists will discuss how they can prepare you with prehab and aid in your recovery post-shoulder surgery. I'd like to introduce our presenters today from the central Pennsylvania area. Samantha Bost, Clinic Director from our Carlisle Clinic. Devin Day, Clinic Director from our Chambersburg Clinic. Katie Karnas, Clinic Director from our Harrisburg Clinic. Monica Johnson, Clinic Director from our Etters Clinic. And Alisha Greene, Clinic Director for our Lancaster Clinic. Our experienced team of physical therapists, occupational therapists, and speech therapists across the Phoenix family are available to help you ease your pain by providing prehab for an upcoming surgery as you recover from recent illnesses. We invite you to visit our website at phoenixphysicaltherapy.com to learn more. If you have any questions during today's webinar, please use the chat feature to ask a question at any time. I will facilitate a Q&A session with the team at the end of the webinar. I'd now like to invite Samantha to begin by sharing what prehab is and why it is important.
Thank you, Melissa. So what is prehab? So prehab is actually receiving therapy before you would receive a surgery. Like you can see in this picture, there's a lot of things going on inside of your shoulder, a lot of structures. So there's a couple of different surgeries that we typically see people during prehab for, including like a labral repair or rotator cuff surgery. A lot of people do kind of fear prehab before surgery, mainly because they're in pain. Like that's why you're going into surgery a lot of times, is because you don't have good function of your shoulder or you're in a lot of pain. But prehab is super important. Leaving that aching, throbbing, stiff and weak shoulder just to rest and avoiding movement completely will actually make your weakness greater, and it'll actually cause you more pain as well. So getting in to see a physical therapist before your surgery is super important. They will also educate you on different positions to avoid. There's certain repetitive movements that you're going to want to avoid with different types of injuries to your shoulder, and we'll be able to educate you on that and positions to maintain as well to help decrease your pain. We'll also be able to give you a good home exercise program that can get your strength up before going into the surgery, which will also improve your quality of life, not only before surgery, but also after. So now I'm going to pass it on over to Devin, who's going to give you guys a few more tips on what you can have on hand to help make your recovery easier.
Thanks, Amy. So there's a lot of different things you can have on hand that you can kind of gather before surgery to make you feel a little bit better right after. So one of the most important things is to have multiple ice packs on hand. A lot of times they'll send you home with one or two that they used for you right after surgery, but it's good to have multiple so that you always have some cold and ready to go when you need them. The bigger the ice pack, the better, so that you can wrap it the whole way around your shoulder so you get the front and the back all at one time. A lot of times dressing is difficult because you can't use both arms and you can't really move your shoulder. So trying to pull a shirt over your head is pretty difficult. So having shirts that button down the front and are 1 or 2 sizes too big for you makes it easier to get your arm in the sleeve and get it on and off a lot easier. This is good to have definitely for a rotator cuff repair. You might not need it as long for shoulder replacement surgeries. It's also good to have pants that have elastic waist so that they're easy to pull on, and also slip-on shoes because you're not going to be able to tie your shoes with just one hand. Many people choose to sleep in a recliner during the first few weeks of therapy because this is usually more comfortable for the shoulder. Having extra pillows that you can put under the shoulder and under the arm while you're sleeping, or just relaxing in a chair, will take the pressure off of that shoulder, and it'll make it more comfortable to sleep. And that's always important to get your best sleep that you can for healing. Katie is now going to share with you what you can expect for your initial evaluation.
Awesome. Thanks, Devin. So upon your arrival into the clinic, you will be greeted by one of our patient care coordinators. They will walk you through some paperwork to complete, as well as go over any insurance information that they may have for you. After completing your paperwork, you will then be greeted by your physical therapist for your evaluation. So during your initial evaluation, your PT is going to start by talking to you about how you are feeling, what current limitations you have, and what your goals are. They will also review any relevant medical history as well as any particular restrictions you may have following your surgery. After this, the therapist will begin to take some measurements. These measurements may include things such as range of motion, strength, functional mobility, and any other relevant measurements. Many times right after a shoulder surgery, depending on what was performed, there are going to be certain restrictions. Your therapist will assess you within those restrictions and continue to assess you as you are allowed to progress. They will also review these restrictions with you. Towards the end of the initial evaluation, your therapist may also do a few treatment techniques with you, depending on how you are feeling, as well as go over a few home exercises to get your therapy program started. So Monica is now going to highlight what you can expect from the general progression of treatment.
Thank you, Katie. So an average physical therapy session is going to be about 60 to 90 minutes long, and that's going to consist of some education, strengthening, flexibility, functional training, and or pain management interventions as needed. So pain control is something that we always address, no matter where you are in your treatment process. We use a variety of different tools to manage pain, such as ice, heat, electric stimulation, ultrasound, massage, as well as other tools. Early on in PT, your surgeon may immobilize your shoulder in a sling. And during that time, we will be working on educating you on posture and positioning to give you the most amount of comfort while you're in the sling. We may also do exercises with your elbow and or your hand to maintain strength and prevent swelling. You may also have trouble finding a comfortable sleeping position, as some of the other presenters have already mentioned. So we'll talk about sleeping in different positions, like propping yourself up or laying on your back, or possibly sleeping in a recliner for a short period of time to get you more comfortable. Now, generally, the shoulder exercises would progress from passive to active, meaning in the beginning, your therapist would be passively stretching your arm. And then as you get stronger and you gain more mobility, you would be actively working your shoulder with or without weights. I apologize for the dog in the background. You may, exercises also progress from mobility to stability focus. So mobility meaning that we want to make sure that you have full range of motion first before we work on strengthening your arm throughout the range of motion. Also, exercises go from isolated to integrated, because at the end of the day, we want you to be able to do functional activities like reach behind your back to tuck a shirt in, or lift your arm up overhead to put a shirt on over your head. Ultimately, our end goal is to leave you with an independent functional home exercise program that you're able to follow through with long term. I'm now going to let Alisha explain why exercises are important for recovery.
Thanks, Monica. There's three main reasons that I'm going to cover that explain why exercises and physical therapy are so important for recovery. And the first reason is to gain your mobility back. And what we mean by that is we mean regaining your range of motion and your flexibility of your shoulder. So following shoulder surgery, like was previously mentioned, you're most likely going to be put into an immobilizer for a certain amount of time to protect the surgery and allow for healing. But what this causes is your shoulder gets kind of stiff and your range of motion, meaning your ability to move your arm, becomes extremely limited. Because of this, you're going to have a hard time doing things such as dressing without difficulty, washing your hair, doing your makeup, reaching up into the kitchen cabinet. And so early on, exercises and your therapy is going to be focused on mobility and range of motion. And this will look differently depending on the type of surgery that you had. But like Monica said recently, it's going to initially involve passive exercises, meaning your therapist taking your arm through gentle ranges of motion, getting you being able to lift your arm up with help over your head. And this is super important early on in recovery because that then allows us to move into the strengthening phase. And so the second reason why exercises are important for recovery is because it helps you regain your normal strength in your shoulder. Once you have a surgery, those muscles are going to get weak and you're going to need to retrain them in a way that's appropriate to function. And there's 4 main muscles that help you move the shoulder, and therapy will early on work on the strength of these muscles in order to be able to contract appropriately to perform motions that your shoulder normally did before the surgery. This is super important for recovery because if you try to move your shoulder without the proper strength in those muscles, you're going to allow for compensations. So you may hike up your shoulder, and when you lift your arm, instead of lifting it up nice and fluidly, you may lean to the side to try to lift it up. And so strengthening is super important for recovery because if compensations, they prevent the compensations. Sometimes what we see with shoulder surgeries is if you develop compensations and don't get the normal strength back, then you may start to have other issues. Like you might start to have neck pain, upper back pain on that side. And then the other thing is you won't be able to do the normal movement patterns like you did before. So you might not be able to lift like the milk out of the fridge or reach up into the cabinet to get, a glass. And so strengthening is super important, and your therapist will design a specific program based off of the areas that they find to be most weak. Finally, the last reason why exercises are important for recovery, and this is the number one goal of therapy, is that we get you back to your pain-free functioning. And what this means is we need to get your shoulder functioning in a way that is specific to you. So physical therapy will ask what kind of goals you have to do. So the goals that you have. So maybe, for example, you're a painter and you want to paint, you have to be able to paint overhead. That's very functional. So therapy will give you functional exercises designed specifically to help you be able to do that. Some other examples include working on shoulder endurance. If you do a lot of overhead work, say you're a plumber and you have to work overhead, if you do construction, you might need to be able to lift heavy objects over your head. And so therapy towards the end is important because it allows you to regain your normal functioning, and the exercises that the therapist will choose will be very specific based on your job or your goals for therapy.
Thank you, Alisha. At this time, we are going to open up for Q&A. Please feel free to use the chat function to ask us any questions, but just to get started, I would like to ask the question that I'm sure many of us are wondering today that are in attendance. How soon before shoulder surgery should someone start prehab?
Melissa, I can take that one. So typically we would like if you could start prehab 6 to 8 weeks before your shoulder surgery is scheduled, because that time frame is actually what it takes to completely build muscle, and it'll also allow us to help progress your shoulder through a good amount of mobility. So when you go into surgery, it'll allow you to come out of it as strong as possible. However, that 6 to 8 weeks is not always possible for everyone. So once you find out you are going to be getting surgery, or even once you realize that you have injured your shoulder, getting in to see a physical therapist as soon as possible is super important. And like we had already talked about in this webinar, we can also really help you with the pain part of things too, and helping stand alongside you to help control your pain as well.
Thanks, Sam. I was also wondering, how soon after shoulder surgery should someone begin physical therapy?
I can answer that one. So that question is very dependent on a couple factors. So the first factor that is dependent on is what type of surgery that you had. So for example, was it a full rotator cuff tear? Did they go in and completely repair it? Did they have to do any pinning of the rotator cuff to the bone? If it was just like an orthoscopic debridement where they go in and kind of clean out your shoulder, that's going to be much different. So it's all going to depend on first thing is the type of surgery that you had. Also, surgeons have a wide range of recommendations that they make. And so some surgeons like you to be immobilized for, say, maybe 3 or 4 weeks, sometimes even longer before you even start therapy. Other surgeons, they like to get you into therapy, a couple days or a week after. And so that really depends on those two factors, what your surgeon thinks is most beneficial, and then also the type of surgery that you have. Your surgeon should be pretty transparent about when you should start, and they'll be able to let you know kind of the time frame and prescribe therapy when they think it's best.
Thanks, Alisha. At this time, I'm going to open it up for any questions anyone attending the webinar this evening may have. So please feel free to use the chat function. We'll give you a few minutes to send us questions. Taylor has a question for you all. Her question is, does anyone have any, or do any of you have any advice for preventing or combating shoulder hiking when regaining motion?
I can take that one. So one thing that is super helpful, a lot of times you don't actually know that you're hiking it. You think it looks great, and then we kind of look at you and say, oh man, it doesn't look that great. So if you have like a full length mirror, or at least you can see from the shoulders up, it's really great to do the motions where you're trying to go to shoulder level or overhead in the mirror so that you see the good motion, and then your brain can kind of comprehend that is no shoulder hiking or no compensated movement, and it looks really good. The other thing that is super important with the shoulder is to actually work the shoulder blade muscles. They are kind of the stability for the shoulder. So it's really important to kind of set those shoulders back and pinch those shoulder blade muscles as you try and raise. So that will help get that normal kind of rhythm of the shoulder and calm down those compensations that pretty much happen for everybody right after surgery. So it's normal, but the faster that you can stop that and get normal motion back, the better.
Great, thank you, Devin. Taylor says thank you. So at this time, if no one has any other questions, we'll go about wrapping things up. If you do have any questions today that you think of after our webinar, it's never too late to contact us. You can reach out and email us at marketing@phx-pt.com, and I will be sure to make sure your questions get answered. I would also say to schedule a physical therapy appointment or request an evaluation with a Phoenix physical therapy physical therapist would give you the best answers to your questions. We have many locations nearby, and you can check if you see our web address here, phoenixphysicaltherapy.com/locations. You can find a location near you. So thank you for your time this evening, everyone. We appreciate your attendance and we hope we were able to answer some of your questions. So have a great evening.